Hello, my name is Jayne Murdoch-Flowers, and I'm in traditional Mi'kmaq territory in Queensland, Nova Scotia, and I'm going to read to you pages 97 to 101 of the TRC report. When A.E. Cote, the Deputy Minister responsible for Indian Affairs, met with church and school representatives to discuss the brief, he told them that only emergency repairs would be undertaken at schools that Indian Affairs intended to close. The badly built and poorly maintained schools constituted serious fire hazards. Defective firefighting equipment exacerbated the risk, and schools were fitted with inadequate and dangerous fire escapes. Lack of access to safe fire escapes led to high death tolls in fires at the Beauval and Cross Lake schools. The Truth and Reconciliation Commission of Canada has determined that at least 53 schools were destroyed by fire. There were at least 170 additional recorded fires. At least 40 students died in residential school fires. The harsh discipline and jail-like nature of life in the schools meant that many students sought to run away. To prevent this, many schools deliberately ignored government instructions in relation to fire drills and fire escapes. These were not problems only in the late 19th or early 20th centuries. Well into the 20th century, recommendations for improvements went unheeded, and dangerous and forbidden practices were widespread and entrenched. In the interests of cost containment, the Canadian government placed the lives of students and staff at risk for 130 years. The buildings were not only fire traps, they were also incubators of disease. Rather than helping combat the tuberculosis crisis in the broader Aboriginal community, the poor condition of these schools served to intensify it. The 1906 annual report of Dr. Peter Bryce, the Chief Medical Officer for Indian Affairs, observed that, quote, "The Indian population of Canada has a mortality rate of more than double that of the whole population, and in some provinces more than 3 times." Tuberculosis was the prevalent cause of death. He described a cycle of disease in which infants and children were infected at home and sent to residential schools where they infected other children. The children infected in the schools were, quote, "sent home when too ill to remain at school, or because of being a danger to the other scholars, and have conveyed the disease to houses previously free." The following year, Bryce published a damning report on the conditions at prairie boarding schools. In an age when fresh air was seen as being central to the successful treatment of tuberculosis, he concluded that, with only a few exceptions, the ventilation at the schools was, quote, "extremely inadequate." He found the school staff and even physicians, quote, "inclined to question or minimize the dangers of infection from scrofulous or consumptive pupils." Scrofula and consumption were alternate names for types of tuberculosis, and nothing less than peremptory instructions as to how to deal with cases of disease existing in the schools will eliminate this ever-present danger of infection. He gave the principals a questionnaire to complete regarding the health condition of their former students. The responses from 15 schools revealed that, quote, "of a total of 1,537 pupils reported upon, nearly 25% are dead." Of one school with an absolutely accurate statement, 69% of ex-pupils are dead, and that everywhere the almost invariable cause of death given is tuberculosis. He drew particular attention to the fate of the 31 students who had been discharged from the File Hills School. 9 were in good health, and 22 were dead. The extent of the health crisis was so severe that some people within the federal government and the Protestant churches became convinced that the only solution was to close the schools and replace them with day schools. However, the Indian Affairs Minister of the day, Frank Oliver, refused to enact the plan without the support of the churches involved. The plan foundered for lack of Roman Catholic support. During the same period, Bryce recommended that the federal government take over all the schools and turn them into sanatoria under his control. This plan was rejected because it was viewed as being too costly, and it was thought that it would have met with church opposition. Instead of closing schools or turning them into sanatoria, the government's major response to the health crisis was the negotiation in 1910 of a contract between Indian Affairs and the churches. This contract increased the grants to the schools and imposed a set of standards for diet and ventilation. The contract also required that students not be admitted, quote, until, where practicable, a physician has reported that the child is in good health. As noted earlier, although the contract led to improvements in the short term, inflation quickly eroded the benefits of the increase in grants. The situation was worsened by the cuts to the grants that were repeatedly imposed during the Great Depression of the 1930s. The underfunding created by the cuts guaranteed that students would be poorly fed, clothed, and housed. As a result, children were highly susceptible to tuberculosis. And because the government was slow to put in place policies that would have prohibited the admission of children with tuberculosis, and ineffective in enforcing such policies once they were developed, healthy children became infected. As late as the 1950s, at some schools, pre-admission medical examinations appear to have been perfunctory, ineffective, or non-existent. In the long run, the 1910 contract proved to be no solution for the tuberculosis crisis. The schools often lacked adequate facilities for the treatment of sick children. In 1893, Indian Affairs Inspector T.P. Wadsworth reported that at the Capel School, the, quote, want of an infirmary is still very much felt. Those infirmaries that existed were often primitive. On an 1891 visit to the Battleford School, Indian Commissioner Hayter Reed concluded that the hospital ward was in such poor shape that they had been obliged to move the children in it to the staff sitting room. According to Reed, quote, the noise, as well as the bad smells, come from the lavatory underneath. Proposals to construct a small hospital at the Red Deer School in 1901 were not implemented. There were also reports of inadequate isolation facilities at the Regina School, 1901, the Anglican School in Onion Lake, Saskatchewan, 1921, the Mission, British Columbia School, 1924, and the Muncie, Ontario School, 1935. When diphtheria broke out at Duck Lake, Saskatchewan, in 1909, the 9 students who fell ill were placed in a, quote, large isolated house. Even though the 1910 contract required all schools to have hospital accommodation to prevent the spread of infectious disease, many schools continued to be without a proper infirmary. The 1918 global influenza epidemic left 4 children dead at the Red Deer, Alberta school. When the influenza epidemic subsided, Principal J.F. Woodsworth complained to Indian Affairs, quote, for sickness, conditions at this school are nothing less than criminal. We have no isolation ward and no hospital equipment of any kind. The Roman Catholic principals petitioned the federal government for the establishment of sick rooms under the supervision of a competent nurse at each school in 1924. At the same time, they objected to the sanitary inspection of the schools by government-appointed nurses, since they recommended changes, quote, leading to the transformation of our schools into hospitals or sanatoriums. There were also regular reports that schools could not afford to hire needed nursing staff. Indian Affairs officials continued to be critical of the quality of care provided by school infirmaries at the end of the 1950s. Complaints from principals made it clear that into the late 1960s, there were still severe limitations on the range of health services being provided to residential school students. General Aboriginal health care was never a priority for the Canadian government. Tuberculosis among Aboriginal people largely was ignored unless it threatened the general Canadian population. In 1937, Dr. H.W. McGill, the Director of Indian Affairs, sent out an instruction that Indian healthcare services, quote, must be restricted to those required for the safety of limb, life, or essential function. Hospital care was to be limited, spending on drugs was cut in half, and sanatorium and hospital treatment for chronic tuberculosis were eliminated. The high death rates led many people to refuse to send their children to residential school. In 1897, Kapapa Ma'am Wakawe Cochin, also known as Tom, was deposed from his position as a headman of the White Bear Reserve in what is now Saskatchewan for his vocal opposition to residential schools. In making his case for a school on the reserve, he pointed to the death rate at the Capel Industrial School, adding, quote, "Our children are not strong. Many of them are sick most of the time. Many of the children sent from this reserve to the schools have died." Death casts a long shadow over many residential school memories. Louise Moyne, who attended the Capel School in the early 20th century, she recalled one year when tuberculosis was, quote, "on the rampage in that school. There was a death every month on the girls' side, and some of the boys went also." Of his years at the Roman Catholic school in Onion Lake, Joseph Dion recalled, quote, "My schoolmates and I were not long in concluding that the lung sickness was fatal. Hence, as soon as we saw or heard someone spitting blood, we immediately branded him for the grave. He had consumption. He had to die." Simon Baker's brother Jim died from spinal meningitis at the Lytton, British Columbia School. Quote, "I used to hear him crying at night. I asked the principal to take him to the hospital. He didn't. After about 2 weeks, my brother was in so much pain, he was going out of his mind. I pleaded with the principal for days to take him to a doctor." Ray Silver said that he always blamed the Alberni School for the death of his brother Dalton. Quote, "He was a little guy, laying in the bed in the infirmary dying, and I didn't know till he died. You know, that was the end of my education." The death of a child often prompted parents to withdraw the rest of their children from a school. One former student said her father came to the school when her sister became ill at the Anglican school at Aklavik, Northwest Territories. Quote, "He came upstairs and there we were. He cried over us. He took me home. He put her in a hospital and she died." The high death rates in the schools were, in part, a reflection of the high death rates among the Aboriginal community in general. Indian Affairs officials often tried to portray these rates as simply the price that Aboriginal people had to pay as part of the process of becoming civilized. In reality, these rates were the price they paid for being colonized. Aboriginal livelihoods were based on access to the land. Colonization disrupted that access and introduced new illnesses to North America. Colonial policies helped wipe out food sources and confined Aboriginal people to poorly located reserves with inadequate sanitation and shelter. The schools could have served as institutions to help counter these problems. To do that, however, they would have had to have been properly constructed, maintained, staffed, and supplied. Government officials were aware of this. They were also aware that the death rates among students at residential schools were disproportionately high. It would be wrong to say that the government did nothing about this crisis. The 1910 contract did provide a substantial funding increase to the schools, but the federal government never made the type of sustained investment in Aboriginal health and either the communities or the schools that could have addressed this crisis, which continues to the present. The non-Aboriginal tuberculosis death rate declined before the introduction of life-saving drugs. It was brought down by improvements in diet, housing, sanitation, and medical attention. Had such measures been taken by the federal government earlier, they would have reduced both the Aboriginal death rates and the residential school students' death rates. By failing to take adequate measures that had been recommended to it, the federal government blighted the health of generations of Aboriginal people. That is the end of this section.